Hello viewers, welcome to another dialogue session, and our guest of the day is Dr. Laimi Ashipala, the Chief Medical Officer in the Ministry of Health and Social Services. Welcome, Doctor.
Thank you very much.
Thank you. And we're here at the Commerce Regional Conference, and our first question to you is, what is the new drug called TLD?
TLD is a combination of three drugs, which is tenofovir, lamivudine, and dolutegravir.
Okay, so how does it work, and how is it different from these other drugs that have been here before?
The difference is that you take one tablet a day, okay, just like the other ones, but then it has less side effects, and then it's also having a high resistant barrier, meaning that you can not easily develop resistance to the drug.
Okay, so does your ministry have a rollout campaign in terms of people accessing it worldwide?
Yes, there is a strategy in place. The transitioning started in October, so we are rolling out in all the 14 regions at all health centers that provide ART services. Okay,
and then there's this 95, 95, 95. It sounds like a secret code. What's that all about?
Oh, the 95, 95, 95, this is a UNAIDS strategy. It's actually a goal for the countries to achieve HIV epidemic control. So these are targets. The first 95 is that of the 95% of people living with HIV should know their status, meaning that they need to be tested for HIV. And then of those that are tested, 95% needs to be on sustained ART treatment. And I say the important aspect here is sustained, because you just don't start a person on treatment today and then tomorrow they default. You need to ensure that they remain on treatment. And the last 95 is that 95% of people that are on treatment, they should be virally suppressed.
Okay, moving on. Do you think, as the Ministry of Health and Social Services, you are doing enough in progressing your agenda of curbing HIV/AIDS pandemic in Namibia?
The ministry is doing quite a lot, and it's evident from the NAMFIA survey reports that I presented today that the country has actually already achieved the 90, 90, 90, and the 90, if I can explain, is that those were the first UNA targets, and then Namibia has achieved that since we are talking of 95 now. So the ministry and the country at large are doing very well when it comes to curbing HIV epidemic.
Okay, in your local statistics that you read here at the Commerce Regional AIDS Conference, how much of those statistics are based from institutes such as correction centers, mental institutes, and primitive remote areas?
Maybe I should educate you on that.
Okay, go ahead.
So basically what happens is that prison or correction and mental institute, those forms part of key populations, okay? So, and you don't include key populations in public studies. So if you want statistics on corrections and mental institutes, you have to carry out a study tailored for them. So on other notes, they were not part of the study.
Okay, to someone who doesn't know, what's a key population?
It's like a special group of, it's not your general public, it's more like a special group of population because they have different needs.
Okay, so...
And they are governed by different acts and regulations.
Okay, so in our last word, what's the Ministry of Health planning for us going forward to 2020 and with the vision 2030 in mind about this deadly disease that's actually killing more women than men here in Namibia? What's the way forward?
Okay, maybe before I answer that, the disease is not killing more women than men. However, more women are at risk of HIV infection than men, and it doesn't necessarily mean that if you are infected with HIV, you die from the disease. So your statement of saying that more women are dying than men is actually incorrect. So yes, women are at high risk of HIV, and there are strategies in place to ensure that, because we are aspiring that Namibia by 2030 we have reached the HIV epidemic control. So the strategies starts from prevention, the prevention package of condoms, abstinence, staying faithful to your partner. We have a new program called PrEP. The young girls and young women are involved in this DREAMS project. So this is from the prevention aspect. And then from the treatment, the rollout of TLD, which is a more durable drug, and to ensure that we also have field workers that ensure that people come to the centers for their medication and they stay on treatment, and then for the viral suppression. And there's also an element of elimination of mother to child transmission, which the ministry has a program towards that. So in a nutshell, the ministry is doing a lot, and we're very confident that by 2030 we'll achieve total HIV/AIDS epidemic control.
Okay, thank you, Doctor. All the best.
Thank you very much.